A new study from Scripps Research is suggesting that fitness trackers can help predict COVID-19. Listen to this. So the study uses a mobile app to collect health data and then determine if the person's symptoms could be COVID or something else. Now, the accuracy of this is pretty high. Joining us to discuss the study is Dr. Giorgio Quird. Dr. Quird, good to talk with you tonight.
Thank you very much for inviting me.
Well, I'm anxious to hear about it because I've been reading about the results, and I know these are early results from the DETECT study that's going on at Scripps, but tell me about it. Give it an overview.
Absolutely. So, well, our main goal is that to quickly identify people with COVID-19, positive to COVID-19. And we do this with this smartphone app that is connected with your smartwatch. The idea is really to look at sleep, activity, and heart rate, and be able to distinguish, really identify people that are testing positive or that are to COVID-19 or that have any other type of illness.
Now, obviously, this would only be for people that are showing or dealing with symptoms, but how key is it to quickly identify folks in the overall scheme of things in trying to battle this virus?
Absolutely. So, so far we have 36,000 individuals that are part of our study, and we have studied in particular people that show some symptoms to distinguish again between COVID-19 and non-COVID-19. The idea is to provide an early alert to these people such that they can self-isolate in time before really spreading the virus to their family, friends, and colleagues.
So how long has this study been going on as far as what are these results from? Because I know it said these are early results.
These are early results. So far, we have, as I said, 36,000 people. We started the study back in March 2020, and we aim really to reach about 100,000 individuals. The next step of the study is really to look also at asymptomatic people. They are about 40% of the people with COVID-19, and we are really concerned that they can spread the virus without even knowing that they have the virus. So that would be our really next goal.
All right, so we're just talking about an app on your phone, and then you need some sort of fitness tracking watch. It doesn't necessarily have to be an Apple Watch, right?
No, the app is free. It is you can find it in detectstudy.org, which is our website. You can install it both in Android and in Apple, and any smartwatch would work. Can be a Fitbit, an Apple Watch, a Garmin, really anything you have. The app will just connect to the smartwatch.
Okay, so it's already out. Can you say it again where we can find it? It's called DETECT Study. Is that right?
Absolutely. It is detectstudy.org. You can look at the website, have more information. You can get a look at the published paper that we just published in Nature Medicine. And, well, you can participate to the study and contribute yourself to this fight against coronavirus.
What else are you finding or at least looking into with this DETECT study?
What else? The main idea is really to identify the virus. Of course, we have there is a large amount of data, so we are studying also how the heart rate is changing, how the sleep and the activity is changing. If you want more details on that, well, a simple examples. Your heart rate may be when you are at rest, maybe have something around say 60 pulse per minute if you are kind of athletic. Well, this value is quite constant over the year, but for a few days it can go up to 70, 75 pulse per minute. So this change, which is a significant change for you, for your specific heart rate at rest, would be a sign of an illness. And that this is what we are actually looking for, and what the type of signals that we're using to do this distinction between COVID and non-COVID.
Wow, pretty amazing stuff. Really quickly, any differences in age groups as far as, folks over 50 and maybe folks under 20 so far?
Well, there are big differences, of course. So their physiological parameters are really different. Our algorithm is really tackled to the individual. So we are basically doing our analysis on the individual. So it's based on the baseline for that individual. So whatever age, whatever condition you are, we are looking at differences with respect to your past. And this is what really will trigger an alert.
Pretty amazing stuff, Dr. Kaur. I'm going to put this app on my phone right now, and I encourage everybody else to do so. Early detection, knowing when to maybe stay home is the key to this right now that we know of. So thank you so much for talking to us tonight.
Thank you very much.
All right, be well.
Bye. Thanks.